I tell my patients all the time, you remember those stretches we did in PE? They will last you a lifetime. As you age, pain is not okay. So experiencing pain for a prolonged period of time, treat it like a flu. If you realize that you're sneezing, coughing, feeling ill often, you're gonna go see the doctor. So I'd suggest if you're feeling pain, see your physician who will recommend you to your physiotherapist. Any physiotherapist, please. It's time we take care of our bodies. Don't wait on an injury.
Welcome to another episode of the Irreplaceable Dental Team. And as usual, I have a treat for you today, but I'm not going to tell you too much about our guest, Miss Akeisha-Lee Byfield. Welcome, Akeisha-Lee. How are you doing today?
I am doing great today. How are you doing today?
Absolutely fabulous. All the better for being here with you. We've been planning this for a while, haven't we?
Yes, we have, and I'm very grateful to be here on your podcast and your platform.
So, I know all about you, but to my audience, our guests who are listening or viewing, tell us a little bit about yourself.
Okay, so I'm Akeisha-Lee Byfield. I'm a registered physiotherapist. I used to be an aspiring dancer, not an athlete, so I don't have that dream athlete story. But I am a very passionate individual, and I would describe myself as very empathetic, loving, and caring, which is perfect for the profession that I have instilled and inserted myself in today.
Oh, so what led you into physio?
If I'm going to be honest, I actually wanted to be a doctor, but I didn't want to study here. I wanted to study in Cuba. However, I didn't want to take a gap year, and then I used physiotherapy as a quote-unquote space holder. However, upon doing my first clinical, volunteer, and rotation at the Kingston Public Hospital, I truly fell in love. The physios were like, I don't want to describe them as gods, but they were just so brilliant. And just to see the work that they were doing, I realized that I didn't want to do surgery. I wanted to help people to feel better, to be better, and have better quality of life.
You got hooked, girl.
I did. I honestly did. The best moments would have been all my clinical rotations. I fell in love with the profession every time I had to do a rotation.
And I would imagine that your patient load varies from age to age, the youngest to the most mature.
Surprisingly, so physiotherapy varies in the public and private sector. So publicly and overall, you have geriatric care, pediatric care, orthopedic, and cardiopulmonary physiotherapy. However, privately, yes, we will target all of those, but people will more come for orthopedic injuries. And we have babies, I call them my babies, ranging from at least 7-year-old to who knows it. Even grandma, who is probably celebrating 100, will say, I'd like to participate and keep my joints going and healthy.
Okay, so that means you're never bored.
No, never bored.
I want to drill down on your pediatric patients, though.
Yes.
I read recently that many kids who have back pain, it's related to a discrepancy in the length of one leg versus the other. Is that so? And can you expound on that if it is so?
Yes, I can. And I actually appreciate you asking that question, because it's something that most recently, I'm going to expound more on the children, but most recently in general, it has been an issue that I see with all my patients, all ages. However, I would say, parents, listen. We grew up in a culture where we're very active and strong, and physiotherapy may have not been the norm, but our kids are much more active nowadays than they were before, and they're also balancing a lot of activities. So, as I said, listen, and there are certain tips I can give to say, look at your child, observe your child. If your child says, mom, dad, auntie, grandma, I feel a little unbalanced, I feel a bit lean. You can even look at their clothing. If they wear, for example, a pant, you can look at the pants and say, okay, does both sides look the same? You can even look at their school bag. When they hold their school bag, does one side look like it's leaner than the other side? So simple things like those.
So would you recommend a backpack as opposed to a school bag on one shoulder?
Yes, and from my own experience, I remember being in high school where primary school, the trend was the pull bags, but going to high school, we definitely grew out of that. But the one strap bags were very popular. To be honest, it felt cool, it looked cool, but it can be a bit damaging. So I recall just going for a regular checkup with my mom at the doctor, and from observation, they told my mom I was starting to develop scoliosis. And yes, and thankfully for that doctor, they asked, does she wear a one-strap bag? And my mom said yes, and this would have been first form where you're introduced to all the books. You're doing at least 12 subjects, so you're carrying all your books. So with the one strap bags versus the two strap bags, I would definitely vouch for two straps.
Okay, so here's my question to you, Akeisha-Lee.
Yes.
Will the misuse of the spine, aka or example, weighing down one shoulder far more than the other, actually create a scoliosis, or will highlight or worsen something that's there underlying?
I would say it would be both, because a lot of times we have different spinal curvatures which are abnormal. So it could be an excessive lordosis. It can be one pelvis is higher than one. It also combines with our posture. So as children and even adults, our posture is usually not correct. Unless you have a very strict parent or teacher who says sit upright, you would really need that reassurance. And as a child, children, they're lying on their stomach to write, they're on the tablets, you're in the couch, one foot. And there's a common thing with babies, like babies find the weirdest, and toddlers find the weirdest positions to eat, so they're twisting and turning. So I'd say most importantly, posture and awareness, and anything else that would come with that.
So assuming their parents listening, and a light bulb just went off, and they want to determine if their child is really experiencing this. They may have been complaining of back pain. What would they then do? Go to the physician and say that they've heard something and wanted to know if you could evaluate to see if there was any unusual curvature of the child's spine? Would that be the first steps?
Yes, I would say that would be the first step. See your physician, which they'll do their own assessment, and then they'll refer you to the physiotherapist, where we'll do our own consultations and checks, and also provide recommendations, whether it would be a home care program or maintaining physiotherapy with us.
Is it about strengthening the muscles so that
always
it's supported?
It's always about your flexibility and your strength and maintaining the integrity of the joint. So I tell my patients all the time, you remember those stretches we did in PE? They will last you a lifetime. But when it comes to the back, because the muscles are so big, it has to be more targeted. So you would really want a professional to at least give you some advice and provide some kind of direction in how to safely stretch without causing any damages.
I have a question, and it has to do with style and fashion. I'm just going to throw it your way. You know those mega heels that these ladies are wearing now?
Yes.
apart from putting the ankles at risk, do those play a role in possible back issues for young ladies?
Well, as a young lady, I cannot vouch for the heels. I cannot walk in heels to save my life. However, I would say it's good and it's bad. Based on the height, then possibly that will put a lot more pressure on the spine. But the wider heels, I think they have been made fashionably enough to help to maintain your balance and distribution. So it may come off a bit more comfortable. I would say it's not really targeting the back, more the foot and the ankle. The back in terms of if you're putting a pressure and strain based on your posture, or if the shoe is uncomfortable, you probably lean to one side, and that's when you may create some problems there.
So if you want to be stylish, use a shoe with a wide heel.
Yes. Or the hot girls always bring a backup.
Yes.
The style these days is no pain, no gain, but I cannot relate.
All right, so I'm going to move on now to women. Specifically during pregnancy, you always hear them complaining of back issues. What are some do's and don'ts that you would recommend for expectant mothers, to support the musculoskeletal health during this time?
So for pregnant women, what I would mostly recommend is comfort, because there is so much changes going on with the body, and especially as a new mother, you want to ensure that your posture, be more aware of your posture. Try and get support from your pillow. So if you're sitting, you can try and get a sacral pillow and a lumbar pillow, or even just a cushion from your home. When you're sleeping, try and find a comfortable sleeping position. If you're on your side, use the pillow for support. If it's more comfortable to sleep on your back, put something under your knees so you can take the pressure off the spine. Your footwear, pregnant women will most times have swelling of the feet. Find a shoe that is very comfortable. Yes, when it comes to back pain, movement. Yes, you're pregnant. Yes, there are changes, and for some women, it may be a bit difficult the further along they go in their pregnancy. So exercise, depending if you were advised by your doctor to not move so much, try and get a bed exercise program. But if you're able to be active, what I would recommend is hydrotherapy. Doing exercises in the water. It can be fun and at the same time very beneficial, and your joints will love it. And also get a massage. Try and get a massage to, relax and ease the muscles, and the baby's already pampered, so you're gonna have a bouncing baby coming up. Mom, remember we used to get massages? So as I come back, comfort. It all comes down to comfort.
Right. I love that. I often see pregnant women lying on the side with a pillow between the knees.
Yes.
Something that you recommend? I mean, you did speak about using pillows under the knees when they're lying on their back, but on the side, would you recommend having the pillow between the knees to kind of keep that pelvis balanced? I don't know.
Yes, I would. Yes, I would, because that is actually the recommended sleeping position on your side, to have a pillow in between the thighs. But women, from my experience, my female patients who have been pregnant before, there is now, as we spoke about trends before, you have the pregnancy pillows that, they're able, it's more life size along the length of the woman. So you're able to probably put a little support under the tummy to further take the pressure off the spine. So perfect position, whether you are pregnant, male or female, you can use that position to take some pressure off the spine if your preferred sleeping position is on your side.
So not to leave the men out, what do you think about these men who really don't realize their age and they're still on the basketball court or playing soccer like when they were back in their teens and end up with all these injuries because the body is not what it used to be. What do you recommend for my male friends who want to do it all but need some advice as to how to protect the body against injury?
HD, I could form a football team with my male patients, both young and old. One thing I can say is our men, they love to be active, and I truly, truly appreciate and respect that. However, the key to all of my sessions when it comes to the men is education. So I have to sit them down and I said, I know you're a footballer. We may not have progressed to the national teams. However, in your respective business league or your clubs, I need you to warm up. So a big factor is warming up. You want to start with those dynamic stretches to get the joints going so that when you play, you won't, you're putting a lot of pressure on it. Sometimes the games are very intense. So warming up so that you can maintain your flexibility. When you're off the field, I would recommend strengthening. We have to keep the joints and the muscles strong. And also rest. What everyone don't realize, when your body says, give me a break, give your body a break. I don't need you to stop completely, because stopping completely is never the answer. You have to keep moving, but you have to take it one step at a time.
So rest, knowing your capabilities, being very, very diligent about stretching.
Yes.
And doing strength training to protect those joints.
Yes.
Agree?
I agree 100%.
So when I'm thinking about our seniors now, because I'm moving up the ladder, the most frequent injuries I hear of are hip injuries, broken hips, knee pain, joint pain. What do you recommend for our seniors or people transitioning into the senior seasons of their lives? What should the average person do to protect?
Yes.
And if they should have injuries, what should their lifestyle look like?
Okay, so firstly, the older we get, we have to first be accepting of all the changes we'll go through. So yes, you may have been able to dance and jate all across the stage. You may have been the fastest man alive at one point. There will be degenerative changes the older we get. And I say we because we're all gonna get old at some point. So firstly, I will recommend for my aspiring grandparents, my favorite population of people, is have an understanding of your body. So yes, there will be degenerative changes, which we know. The arthritis that nobody wants to hear anything called itis. Try and become active. Activity, the older you get, is very important. So you may not have been able to do the loading you were used to when you're in your 40s or 50, but get a very light exercise program. Again, we come back to the swimming, very low load. And if you have a friend, go for a walk. In Jamaica here, different parishes, you might have a park or a field close to your home, or you live in a gated community. Take a nice stride in the morning or in the afternoon. You can purchase light equipment like doing cycling at home, an elliptical or the treadmill. When I go back to the cycling, you have pedal cycles where you can sit on your chair and just cycle and keep your muscles and your joints very active. Also, older generation is prone to falls. You have to check with your physician from time to time. What is your balance looking like? What is your coordination looking like? You need to have an idea of where you stand. So it's not just your flexibility and your strength, and you also have to assess your home. Do you need grab bars all over your home, just in case you wake up one day you're not feeling your best? What is their flooring like? Is it tiles? Is it carpet? Will you slip? You have to also ensure that the clutter, the older we get, we have to declutter to prevent these falls. Because as you said, most common, we have hip replacements, which is usually as a result of a fall.
Yes. So, as a physiotherapist, should physiotherapy become part of the health and wellness routine of someone who A, maybe have had a history of an injury, or B, who is naturally aging and realizing that the flexibility, the strength, all of that is not what it used to be? There are more aches and pains. Would you recommend physiotherapy as a routine part of health and wellness?
Yes, I would, because physiotherapy is a lifestyle. I came up in the public system and also transitioned into private practice, which has helped me to learn different things over the years. So it's a bit more fast-paced where you have an injury. You are trying to target getting better to fix whatever problem you have currently. However, you have a patient call you 3 months down the line, a year down the line, to say, hey, my back has acted up, or the knee's not feeling so well, or my shoulder, it feels as if that pain has returned. So what I'd recommend with my patients, as I stated before, education is key. So our first session, we go through the consultation to say, okay, we're gonna try and target about 4 to 6 sessions or 6 to 8 sessions, depending on how intense the injury is. When you're completed with those sessions, then we'll put you on a 2-week break. Once you're able to successfully maintain and manage your pain and exercises over that 2-week break, we transition you into a 1-month break. When you transition from that 1 month and you're pain-free, we recommend that our patients do a maintenance. It can be a monthly maintenance, every 2-month maintenance, a quarterly maintenance, but it is important that you maintain, as I'll emphasize, your joints and your muscles. So it's a lifestyle.
Thank you for that. I'm just going to share with our audience the fact that you came into my life at a very critical time. I developed an occupational injury.
Yes.
Lower back. And when we started, we did use the pool. And I think you had me on 2 tracks, one for strengthening and one for pain management.
Yes, I did.
And we were on, I think it was twice a week for a while.
Yes, it was.
Oh, I'm down to once a week, and it's more maintenance and pain control, and not so much strengthening because I'm doing my homework.
Yes, guys, she is a very lovely patient. One thing she'll report, I do my morning walks. If I don't get to do my morning walk, I'll do my evening walk. I'm very proud of you. And I would like to kind of expound on that to say, sometimes when I'll see you, probably we'll have like a 2-week gap. You're just like, I'm feeling well. And then after a session, you're like, wow, I didn't even realize that my body was so tense until after treatment. And that's something very common with our patients.
Yeah, that is true. I think I'm feeling good. And then I realize after, now I'm feeling good. So yeah. I think there's a way your body, your brain just allows you to adapt and adjust to whatever is happening. So normal can range from here to here, and you can't even feel the difference until you get a reset. I'll put it that way. So now that I've shared my business, I want to ask you, is there any crucial point that I missed, a piece of advice that you wish everybody had for this health and wellness journey as it relates to physio?
Yes, I would like everyone to know, don't wait on an injury. And also, as you age, pain is not okay. So experiencing pain for a prolonged period of time, treat it like a flu. If you realize that you're sneezing, coughing, feeling ill often, you're gonna go seek the doctor. So I'd suggest, if you're feeling pain, see your physician who will recommend you to your physiotherapist. Any physiotherapist, please. It's time we take care of our bodies, because that's our temple, so that we can live longer, feel healthy, and I aspire to have some grandkids. You want to be able to lift up your grandkids, play with them, and just have a very lengthy and meaningful life.
I think that's some good advice. You have provided us with some great gems today. Thank you very much.
You're welcome, and thank you for listening.
All right, now, but I have something up my sleeve I'm about to pull out. I have some rapid fire questions for you.
Oh, she didn't tell me about this.
Oh, yeah, that's so fun.
I love it.
All right. First question, favorite food?
Sushi.
Sushi, you're a sushi girl?
Yes, I'm a sushi girl.
Place on your bucket list to visit?
Germany.
Why Germany?
Because I feel like they're very high tech in sports medicine, and I would just want that exposure to learn something new, to bring back to Jamaica, to make recovery and wellness a difference here.
Okay. Can you imagine if I had given her the questions before? Favorite movie?
My favorite movie, oh my gosh, it's so much. I say I Wish Upon a Star. It's a Disney Channel show.
Okay.
And it was really two sisters, which is very dear to me. Two sisters who are very different. Typical Disney movie. They switched places, which made them have a better understanding of each other, which I can say kind of reflects my current life, because my sister and I were 9 years apart. So, growing up, I'm very motherly and strict. And then now she's like my twin bestie. So That movie is the first thing that I always go back to, that movie from Disney.
Final question. What is one piece of advice that you would go back and give to your younger self, high school?
Okay. Wow. That's actually, I say give myself grace, which I learned from you. That was our 2024. That was our theme for 2024. So I would give myself some grace, because I did go to a very competitive high school, which sometimes the pressure is not normal. And I just want to add to, especially the young persons watching, it's okay to take your time. There is time to grow, there's time to learn. Do not rush through school. If you need a break, have a very mature conversation. And I can let you know, I had a lot of quote unquote failures in my early educational life, but oh my God, I'm a superstar now. So I'd say be patient and give yourself some grace. And to add, find yourself someone who can mentor you and you can look up to, because I'd like to tell the audience a surprise that Dr. Lawson Myers, she is such a beautiful person, and her being in my life over these past few years, it has been such a blessing, because you are so pure, and especially as a young businesswoman, a Black woman at that, in a third world country, you have taught me how to navigate and how to become more successful. And I do owe a lot of my recent career ventures to you. So I'd like to say thank you for helping me to find my grace.
Wow, I didn't expect that. You are so welcome. And thank you for your generosity of thanks about that.
Yes.
And it's been my pleasure to see you blossoming and blooming and growing, and your joy is my joy.
Thank you.
So listen, I've shared my physiotherapist / mentee with you guys. I know you now understand why I see her as awesome. You have to promise us one thing, Akeisha-Lee. Akeisha-Lee.
That's a common one. Guys, she called me Miss Byfield. I don't know. She be calling me Miss Byfield. Akeisha-Lee, who's that?
You have to promise us one thing.
What is that?
We'll return to share some gems with us in the future.
I've been waiting to come on this platform since it launched, okay? So, of course, whenever you're ready, I'll be happy and ready.
All right. Thanks a million.
And thank you.
Well, Miss Akeisha-Lee certainly did drop some gems on us today. We have to make sure that our children or grandchildren are observed very carefully, because the difference in one leg versus the other can really cause some serious discomfort to our children. We need to be paying attention, and no one strap bags. We need to be looking at backpacks, even out that weight, and recognizing that scoliosis is a real thing. That twisting of the spine can either be created or exacerbated with that single strap bag. So let's even out the weight for those children and pregnant women, men, aging population. What are the buzzwords? Flexibility, strength, and protecting the joints. All right, ladies, go fashionable, but go smart. Wear those heels, but make sure they're the broad heels. You do less damage to your body when you do that. So, what do we need to do? We need to take care of our bodies. We need to make sure that the muscles are strong enough to support our bones and joints. We need to make sure that we're flexible, and we absolutely need to recognize that physiotherapy can be a part of your wellness routine. This and so much more we learned from Akeisha-Lee Byfield this evening. Listen, share this with someone, like, subscribe, and remember, life is so much better when we live, love, and learn together. See you the next time.